have the honor of introducing a dear friend. I get so excited. I speak fast and okay, jump ahead. So Sharon Whiteman has dedicated nearly 40 years to the field of health and wellness, including 20 years as a critical care clinical nurse specialist. As the president of the Lyme Disease Association of Australia, LDAA, since 2013, Sharon has developed and built strong relationships with politicians, researchers, and medical experts in Australia and globally. Partnering with many volunteers, she has confirmed LDA's status as the peak patient body in Australia. Known for compassion, integrity, and diplomacy, I even learned a lot from her. She remains fiercely driven to achieve justice for tick-borne disease patients. Despite facing her own health challenges following a tick bite, Sharon leads with professional adaptability and a tireless commitment to change. Let's welcome her. She's from down under, from Australia.
Thank you so very much, Leona. To you as well. Just to check that you can hear me okay. Yes? Gordana?
Yes.
Okay, perfect. Thanks, Canal. So it's a great privilege to be here and a great responsibility as well to represent people sick now and into the future in Australia and people facing tick bites. It's a very tricky situation in Australia, so I'm very grateful to have this opportunity. We'd like to welcome you to Data Down Under, Unpacking Australia's Tick-Borne Disease Story. Our goal is to connect the dots between the data that we have and the realities on the ground here in Australia. Most importantly, we'd like to bridge these gaps, but it's not just about the data, it's about creating a safer and healthier future for Australians and our visitors. I represent a small but deeply committed team at the Lyme Disease Association of Australia. I'm Canadian-born, now an Australian citizen, but most often I'm asked if I'm American. So I think I have the right to fly 3 flags slide. I'm also a retired specialist ICU nurse, as Leona mentioned, and I'm not yet recovered Lyme patient. While I have lived and breathed this content for almost 15 years now, I currently operate at about 50% or less of my cognitive function, so I will be cheating and using notes today. And you know, I think you'll be glad that we avoid any of my typical comedic brain mishaps. It's not a good look. So there's also an unapologetic lived experience overlay to this presentation. You know, I am still sick and I deal with sick people day in and day out, and we're so grateful to have this voice. Being an Australian Lyme patient is a very tough gig, and it's a real privilege to represent them here today. And it's also important to note that neither myself nor the Lyme Disease Association of Australia have any conflicts of interest related to this presentation. Understanding the integrity behind this work helps us trust the insights and the data that will be presented. Sorry about that. Tick-borne diseases in Australia are denied, ignored, and or misunderstood. Most illogically, that includes both local and overseas acquired infections. People report to us that they show up at the doctor's office and said, I got bit when I was traveling, and the doctors will tell them that there's no Lyme disease in Australia. However, the science refutes that position. The 2023 international paper, Perception of Ticks and Tick-Borne Diseases Worldwide, says it well. For the past few decades, Australian patients, medical practitioners, research scientists, and the government have been occupied by the question, does Lyme disease exist in Australia? However, a historic review by the group Black Dot, they're a patient-driven group, they provide evidence to counter that narrative. Extensive research and government reports between 1982 and 2020 document the presence of Borrelia burgdorferi and Lyme-like illnesses in Australia, while highlighting pathogen diversity and complexity. We intend to examine the current state of tick-borne diseases in Australia, supported by a global context and including analysis of patient impact data extracted from 2 separate Senate inquiries, submissions in 2016 and 2025. We'll look at a review of 3 independent patient blood testing data reports, and then we'll conclude with a pathway forward for evidence-based reform in Australia. We ultimately aim to challenge current assumption and the repetitive narrative that Australian ticks rarely transmit pathogens to humans. We'll look at a combination of unique biodiversity, compelling lived experiences, and laboratory evidence. Ultimately, our goal is to provide a robust evidence base for actionable reforms in country. Our purpose is clear. Every year, tens of thousands of Australians face the reality of Lyme disease and related illnesses. Early Australian tick-borne disease reports surfaced in similar timing to those in the US. And in the absence of local surveillance, applying the US 2016 prevalence rate of 1.78% to Australia is logical and suggests a potential for over 22,000 new tick-borne disease cases annually. That would indicate a potential cumulative burden of 500,000 people. And more recently, a global review of 39 countries found an estimated average global prevalence is 5.8%. While possibly hard to imagine, this could mean that nearly 1.3 million Australians may be affected by tick-borne disease over the past decades. And the bottom line is the real numbers are unknown. They're not known at all. They're not counted. They're not looked at. Yet there's no doubt that a significant public health crisis is hiding in plain sight here in Australia. Dr. Jeremy Brown, an emergency physician and scientist in Australia, provides a unique patient insight in his analysis of 698 first-person submissions to the 2016 Senate inquiry. His findings are clear. Recent epidemiological studies indicate that the true incidence of human tick-borne diseases in Australia remain vastly underestimated. This calls for urgent action, including enhanced surveillance and greater clinical recognition. Now, this is not a typical, not a Lyme knowledgeable doctor. He's just an infectious disease interested physician that took a look at the Senate submissions. This was a very clear call to government in action in 2016, and it's been categorically ignored. So now we'll just take a look at the data. We'll highlight three key data areas. First, our unique Australian ecology. Second, we'll look at the lived experience of Australians facing significant barriers in diagnosis, treatment, and care. And third, we'll look at testing correlation and international testing data of Australians. These pillars underpin a comprehensive understanding of the scientific evidence of tick-borne diseases in Australia. Australia is biodiverse. We're world renowned for biodiversity. Australia's ticks reflect that distinctiveness. With over 70 native species, most found nowhere else, they have co-evolved alongside native wildlife such as possums, bandicoots, wallabies, and birds. Over time, these complex relationships have extended to livestock, humans, and pets, underscoring deep ecological interconnectedness. In addition, recent reports of 5 known introduced tick species bring international pathogens that can now be locally acquired. Truly understanding tick-borne diseases in Australia requires appreciating this complex and unique environmental context. Now, this is interesting in that it's no surprise that Australia's unique tick ecology supports an equally diverse array of tick-borne pathogens. Many of these microbes are uniquely Australian, further reflecting our distinct environment. Again, as confirmed by the Black Doc team in their literature reviews, over 68 peer-reviewed articles and bulletins document the presence of tick-borne pathogens, yet they remain largely ignored in human healthcare. The image you see here is from the paper Perception of Ticks and Tick-Borne Diseases Worldwide, and it highlights that there's 23 unique pathogens that have been identified in Australia, and that number is more than double the next highest global region in their review. So we're significant in our impact of tick-borne pathogens, but nobody's looking here. It's important to note that the animal health surveillance is highly sophisticated. With rapid reporting, mapping, and response systems to protect Australians' agricultural value, notably, Australia's cattle population nearly matches its human population. So you see all those cows there. They're looked after very well here in Australia, but Australian citizens, not so much. This is a critical gap. There is an urgent need and a social responsibility to implement our surveillance systems for human health that are equal to or better than those protecting our livestock. Looking through a lens of patient experience and scientific integrity, the core recommendations from the 2016 inquiry were denied, misinterpreted, inadequately acted upon, or even implemented in ways that we can now see were harmful to patients. The urgently recommended 2016 epidemiological review has never been initiated. If we have the local capacity to deliver robust surveillance for livestock, we really need to ask the question, is this a case of don't look and can't find? Or are we simply asleep at the wheel? Looking at the patient impact data and building on the ecological context, the public health insights are from the 2 inquiries that we've had are profound. The next 6 slides will focus on present findings from our analysis from 349 patient submission 2016 inquiry. That represents 34% of all responses to that inquiry. And it was into Lyme-like illness at that time. They keep changing the name, trying to figure out a way to, I don't know what they're trying to figure out, to be honest. These patient insights are then further supported by the analysis of international laboratory diagnostics we'll take a look at. And the real sobering fact being that behind every number that we're about to discuss and maybe even casually disclose today, there is a real Australian, each with a story highlighting the urgent need for better recognition, diagnosis, and care. The Senate submissions revealed distinct statistical patterns highlighting major patient challenges. Today we'll be focusing on key critical issues, one being medical dismissal, which deepens patient distress and delays appropriate care. Persistent misdiagnosis, often spending many, many years. Significant, sometimes overwhelming financial burdens, and broad psychosocial impacts affecting families and livelihoods. And please know that none of today's insights would be possible without the dedication of our co-authors, Jackie Van Tullingen and Elaine Kelly, you see on their screen now. Their invaluable contributions over many years have shaped every aspect of this work, and our heartfelt gratitude is beyond measure. Alarmingly, only 6% of Australian doctors accept a positive Lyme disease test as valid. In fact, false positive declarations are the norm for patients presenting to their medical doctor. This obviously poses a major barrier to timely diagnosis and effective treatment, which is critical for outcomes in tick-borne diseases. And while international diagnostic tests are accredited and validated through bodies such as the International Laboratory Cooperation, Mutual Recognition Agreement, or ELAC-MRA, which makes it much easier to say, and Clinical Laboratory Improvement Amendments, CLIA, it doesn't matter to doctors. They don't know about that and they don't care about it. And that may sound like a gross generalization, but we see patients every single day in our inbox. The reality remains that most Australian doctors either refuse to acknowledge these results or risk professional consequences should they choose to do so. Many barriers to timely diagnosis are revealed in our Senate submissions that we looked at. 46% of patients saw more than 7 doctors before receiving a diagnosis, with most seeing more than 10. 28% reported being dismissed by their infectious disease specialist. On average, it took 10.75 years from the initial tick bite to receive a diagnosis, leaving many patients to endure a lifetime of illness. Looking at the financial impact of tick-borne diseases in Australia, we find that tick-borne disease patients face severe financial devastation. 65% of patients exhaust their entire savings on healthcare. 84% must take extended time off work or study. And while the average Australian spends around $1,195 annually on health costs, Lyme disease patients report an average of over $42,000 per year. And that's a staggering 3,570% higher financial impact and burden than the average healthcare consumer. The financial toll exposed in the Australian Lyme patient submission is breathtaking. Community health-related costs are estimated at $964 million annually, with the average reported loss of income exceeding $43,000 per patient. And tragically, 11% of patients are having to sell their family home, something that our family experienced, our family of 5, experienced firsthand just 18 months ago. It was my forever property. I wanted to live there till the end of my life, and the grief of losing that and the impact on our family is only starting to lighten and normalize now. The human toll is equally distressing. 73% believe their infection was acquired in Australia. 44% report suicidal thoughts, and 25% are unable to drive or leave home, causing severe social isolation. Ultimately, sick Australians experience what can only be described as a devastating cascade of losses. It's impacting every aspect of their lives. And this quote from a patient who was in a very dark place sums it up. The life I wanted had been taken away from me. I couldn't do the things I wanted to do with my children. Every day was just pushing through with increasingly compromised function, and it was scary. But this woman, with extensive and ongoing to this day international care, has returned to a very high functioning PhD life, fully contributing to society and family life in the area that she's gifted to do so. I mean, that's what everybody in Australia should have access to. And finally, and arguably the most important critical patient impact to highlight, is that of our children. In the US, children account for 25% of Lyme disease cases, with congenital transmission noted to be likely very underreported. Conservatively applying our 2016 prevalence estimates, this suggests that up to 5,500 Australian children may be affected every single year. And this illness is, it's an illness no adult would wish on their worst enemy, never mind a child. The toddler pictured here on your slide that you can see is someone that I know personally. She was born with congenital Lyme disease, and she's now a senior teen. Her ongoing current day suffering is indescribable, just as Dr. Lambert describes on the screen. To be frank, even adults would struggle to navigate the complex and tortuous clinical picture she experienced today and every day, And this is a call to Australia: you must do better. This is just not good enough. And this is me. A couple of months ago, I've chosen to share these images not only because we have permission, because I only had to ask myself, but because they're visual, when the majority of our collective suffering remains invisible. In brief, my tick bite and bullseye rash occurred in Queensland, Australia 23 years ago. I consulted 17 doctors, faced multiple misdiagnoses before self-diagnosing 5 years later after a positive overseas test. But a positive test was not a pathway to treatment. And because of this persistent and worsening and 24/7 very uncomfortable rash, I was encouraged to seek blood tests, which then indicated persistent infection. I had positive results 2 months ago, I might be 2.5 now, for Borrelia, Bartonella, and Ehrlichia. Now, the rash is mostly resolved today thanks to prednisolone, but the status of the infections, it's anybody's guess. And there hasn't been treatment, so I guess they're just still there. Ticking time bomb, isn't that what they call it? So most Australian tick-borne infection patients face these impossible decisions and what I would call as a forever battle. In the middle of experiencing all this, that's what Lyme disease feels. It feels like it's going to go forever. Now to look at Australian test results. As the first of 3 internationally supported comparisons, these are findings from a head-to-head concordance analysis of testing using Tickplex at Armin Lab, concurrent with an established Australian laboratory. Out of 15 Australian patient samples, there was strong concordance showing diverse IgM and IgG responses to Borrelia and other tick-borne microbes consistently identified in both labs. These results underscore the reliability of international testing and highlight the gaps in domestic diagnosis here in Australia. The next sample of testing we'll look at is a retrospective audit of Armin Lab's testing records from 2022 to 2024. They identified 117 Australian samples. These results were submitted to our most recent Senate inquiry, Access and Diagnosis of Treatment for Australians with Tick-Borne Diseases. They decided to get away from Lyme-like. It revealed that 32 to 35% of tested individuals had measurable markers of Lyme disease or persistent forms of infection. Notably, these percentages align with findings from previous studies, such as Gargate al. in 2018. And a third correlation, Dr. Shaw from IGeneX Laboratory in the United States analyzed historic Australian patient samples again for the 2025 Senate inquiry. Out of the 600 samples submitted to IGeneX between 2016 and 2023, 195 or 32.5 tested positive for various tick-borne disease pathogens, including species of Borrelia, Babesia, Ehrlichia, and Bartonella. Again, those findings closely mirror those from Armin labs, around a third approximately, further reinforcing the evidence for diverse tick-borne infections amongst Australian patients. Ultimately, this data validates what patients have long reported. Australians are sick and sometimes dying after tick bites. With extensive reports and submissions to government by scientists and clinicians over 3 decades, Dr. Brown's 2016 submission definitely sums it up perfectly. In 2025, on behalf of patients, the LDA confirms that the existence of endemic tick-borne infections in Australia remains both controversial and categorically denied by those that have the power to make change. So now we'll take a look, shift gears a bit, and look for a way forward. Having examined the significant challenges, we highlight a blueprint for change to effectively address tick-borne diseases in Australia. The data just presented offers robust evidence base to support this urgent call to action for the Australian government, regulatory bodies, medical colleges, and scientists. We recommend a complete government U-turn with rapid integration of surveillance, epidemiological review, and clinical advancements, as well as concurrent development of a coordinated national framework. Government U-turn would in turn unlock a clinical U-turn. It's just logical. And here's what Australian healthcare urgently needs. First, official government recognition of Australian acquired tick-borne diseases, including persistent and chronic cases. Second, acceptance and validation of results from internationally accredited laboratories, ELAC, MRI, and CLIA. Restoration of medical autonomy for clinicians, enabling choice of diagnostic tests and evidence-based treatment pathways. Adoption of global best practice in integrative guidelines for managing these complex conditions. Additionally, by triangulating the ecological gaps, patient experiences, and diagnostic data, we also call for the establishment of a national tick-borne disease surveillance and reporting system, providing the foundation for an Australian real-time tick observatory, the creation of a national centre for tick-borne diseases, funding for an independent research and policy task force, and finally, an independent audit of past inquiry recommendations. Australia, we simply, let's wipe the slate clean and learn from our mistakes and move forward and do the right thing. So in summary, our data and priorities provide observational evidence which underpin rationale for key pathways by serving as an early warning system to help prevent harm to patients, equipping, that's probably citizens, would be a better way to put that, equipping government with data to improve tick-borne disease education for doctors, supporting doctors to deliver treatments previously denied because of a supposed lack of evidence base, and then I'm adding an extra one, providing a real critical world data to enable scientists to identify emerging risks, generate hypotheses, and guide ethical and effective research. Australia, listen up. Moving forward is going to require change. To achieve meaningful progress, the current illogical and unscientific stance held by government bodies, regulatory authorities, and medical colleges must be urgently reconsidered and transformed. Only through evidence-based recognition and collaborative action can we improve diagnosis, treatment, and patient outcomes for tick-borne diseases in Australia. And this is why. This is Tanner. he had a happier outcome, thank goodness. His family, though, fought for years. They traveled across multiple states in Australia and endured enormous strain at every level, and in the end won. While Tanner, is very vigilant and has to be very careful about his health, he has an active life. He's currently finishing year 12, and he now fiercely advocates for sick people in Australia. Behind every statistic is a person like Tanner, awaiting for their human right to timely and appropriate care. And this is our why, and it should be everyone's why. And we call for this and better for all of Australians. Now, in completion, I'd just like to say thank you, especially to Dr. Leona Gilbert, who was the driving force and the inspiration and kicking me in the ribs, keep going, Sharon, for many of this presentation and the actions we've taken over the last, I think, 8 years. We really appreciate her for her visionary leadership and unwavering commitment to unite patients, scientists, clinicians in the advancement of knowledge. We need to drive progress in tick-borne disease research and recognition, and I believe gatherings and research conferences like this is very important. Also highlight a special thank you to our Australian colleagues, Britt and Marie. I couldn't have done this. I would have quit this presentation a million times if it wasn't for them, and also the doctors, medical scientists, medical professionals, and tireless advocates. There's other groups other than ours. Some are listed here, and some remain. Many and probably most remain deliberately unnamed, but they are all deeply appreciated. Our collective perseverance has never been more vital, and together we are shaping the future of tick-borne disease care, and that will save lives. So I'd like to thank everybody in Finland. I'm so sorry. Again, my brain function, we started laughing. I withdrew from being there in person because we reckoned I'd probably end up in some airport and lost and never be seen or heard from again. So to look after me, I stayed home, but I'm sad watching you guys all there. I would love to be there. So, and here's a few references, like our previous expert, amazing speaker said would put us to sleep. And thank you for listening. I'm not sure how good I'll do with questions, but I'm definitely very happy to do my best.
Okay, there's a question from online. So Sharon, the question is, are there any known hotspots or zones in Australia with infected ticks? I wish to inform my friends there.
Well, there's nowhere in Australia that's immune. There are hotspots. On our website, there's a map, and you can see some of our previous maps. It's a picture with ticks. If you look under Lyme disease and then under Australia, you'll find that. But ultimately, it's coastal, around more along the East Coast, but there's people everywhere. And like we were on a call with politicians the other day, and this politician was new to tick-borne diseases in Australia. She says, "I'm so glad I'm in South Australia because we don't have them here." You have to explain to people there's no borders. This is a country that I'm from Canada. It's a big country, and they're found everywhere, and especially the global travel of birds, right? Overseas birds. They can be anywhere, so you can look you can see the hotspots that are known. Our prevalence and our tick bite mapping is going to restart sometime hopefully before the end of the year.
Okay, thank you very, very much, Sharon, for joining us.